Hello, everyone. My name is Monica Bryant, and I am a cancer rights attorney and Chief Operating Officer for Triage Cancer. And I'm delighted to be here today to talk to you a little bit about health insurance. One of the challenges with health insurance is that we often need it, but don't always understand it. And so I'm going to spend the next, half an hour walking you through some of the basics around health insurance and then how you can make educated decisions to pick the right policy for you. But before I get into it, I do have to share with you that I am providing general information today and that I have no pertinent financial relationships or conflicts of interest to disclose. I also only have 30 minutes with you today, and so chances are you may have questions after today's presentation. So in addition to all of Force's amazing resources, I just want to tell you a little bit about Triage Cancer so that you can reach out if you need additional information. We are a national nonprofit organization that provides free education on the legal and practical issues that can arise after a cancer diagnosis. And that really runs the gamut from, of course, health insurance to employment issues, to disability insurance, to finances, to estate planning. We have resources on all of those topics and more. We provide our education in a number of ways, including hosting our own events. And one event I wanted to just let you all know about is our Triage Cancer Conference. We will be hosting them next year as well, both in person and virtually. We also have tons of resources on our website, including quick guides and checklists, and I'm going to walk you through one or two that are very relevant to health insurance specifically. All of our information is also included in English and Spanish. So you may have heard the term financial toxicity. It has certainly become a common term in the cancer community over the last several years. And one of the challenges with cancer is that many people experience a financial burden after their diagnosis. And one of the reasons it's so hard to deal with this financial or toxic is that there are multiple contributing factors. At Triage Cancer, we believe one of the most significant contributing factors is somebody's health insurance status. Now, that could mean not having health insurance at all, but more often what we see is that it's somebody not having the right policy for them or not knowing how to effectively navigate the policy once they have it. Of course, the employment changes that can occur after a cancer diagnosis can impact somebody's finances. And then all of the things that normally impact our finances in life, like relationship changes or moving or graduating, those things continue to happen even after a diagnosis. Because we know that health insurance status is the number one most significant contributing factor, how do we start to address that? Well, we make sure that people are picking the right policies for them. But the unfortunate reality is that most of us don't spend enough time making these health insurance decisions. And so there was recently a study done looking at the number of time people spent making big purchases, things that cost hundreds or thousands of dollars even. And as you can see here, people spend on average 10 hours researching what car they're going to buy, 2 hours researching what television they might buy, or flights take about 5 hours of research because those are big purchases. But guess what? So is health insurance. And on average, people spend 15 minutes or less per year deciding their health insurance options. When we talk about addressing financial toxicity and making sure that people have access to adequate insurance, whether they've been diagnosed or not, this is a problem. So hopefully I've convinced you all that we need to be talking about health insurance and spending more time on our health insurance choices. But the other piece about it is it's like learning a new language. And yet, where do we actually go to learn that new language? Studies have shown that less than 4% of Americans can accurately define the most common terms used in a health insurance policy. So if we don't even understand the words that are being used, how can we possibly be savvy consumers when it comes to purchasing our insurance? So today, with that in mind, I'm going to start at the very basics. There are some terms around the costs of health insurance, and the cost just to have health insurance is referred to as your monthly premium. This is a fixed dollar amount that you're going to pay each month just to have health insurance. It's very similar to having car insurance all year, but never getting in an accident and filing a claim. But then with health insurance, there are some additional costs you're going to pay once you actually use your medical care. The first is your annual deductible. And again, this is a fixed dollar amount, and it's what you have to pay before your health insurance policy kicks in. Now, this amount is going to vary from plan to plan. You could have a plan with a $500 deductible or maybe a $5,000 deductible. But again, it's going to be a fixed dollar amount. Once you pay that amount, your health insurance kicks in. And that's what's referred to as your cost share or your co-insurance. And this is going to be a percentage. So if you have a plan with an 80-20 cost share, once you pay your deductible, your insurance kicks in and pays 80%, and then you're responsible for 20%. Now, many plans have an additional cost called a copayment. And again, this is going to be a fixed dollar amount that's going to vary from plan to plan, but it could also vary from service to service. For example, you could have a plan that has a $20 copayment to go see your primary care physician, a $30 copayment to go see a specialist, and a $250 copayment if you end up in the ER. But one of the most important things to understand about your health insurance policy is the out-of-pocket maximum. Because the out-of-pocket maximum is, in theory, the most you're going to pay out of pocket for your health care during the year. And the way that you get to that out-of-pocket maximum is a math problem. So we add up everything you pay towards your deductibles, everything you pay towards your co-insurance, and everything you pay towards your co-payments. So it's literally everything you're paying out of pocket except those monthly premiums. The value to understanding the out-of-pocket maximum is it allows us as consumers to plan around a worst-case scenario. Now, there are lots of details involved here. We don't have time to get into all of them, but keep in mind that if you have an employer policy, this math problem could be a little bit different for you. They might carve out co-payments, for example. So it is important for you to go back and understand what the out-of-pocket maximum is for your plan, both the dollar figure, but also what's included in that math problem to get to your out-of-pocket maximum. So here is an example to show you how this all works. Meet Dan. Dan has a policy with a $2,000 deductible. It's an 80-20 co-insurance, and he has an $8,000 out-of-pocket maximum. Dan hasn't used any healthcare yet during the year, but he gets into an accident and ends up with a $102,000 hospital bill. So what does Dan actually have to pay? Well, the first thing we always have to pay is that annual deductible. So he pays the $2,000, which leaves $100,000 of the bill left. Now his insurance kicks in and pays 80%, and he's responsible for 20%. 20% of that $100,000 is $20,000. But does Dan have to pay that $20,000? No. He only has to pay another $6,000 to reach his out-of-pocket maximum because he's already paid $2,000 in his deductible. So once he pays another $6,000, he's reached the $8,000 out-of-pocket maximum. Now, I am not suggesting by any means that $8,000 isn't a lot of money. Of course it is. But when we start looking at the alternative of what Dan would have to pay without the out-of-pocket maximum, which would have been the $22,000, or certainly what he would have had to pay without health insurance at all, which would have been the $102,000, that $8,000 starts to feel a little bit more reasonable. And again, the idea here is that we as consumers can plan around a worst case scenario. So if you would like to hear any of that again, the terms that I just went over, or this example, that's included in one of our short animated videos. It's only about 5 minutes long on health insurance basics, and it's available in English and Spanish, and has closed captioning as well. And it's on the triagecancer.org website. So there are two main payment systems in this country. There's what's called fee for service, which means you can go to providers, they will charge you a dollar amount for your services, and you pay that dollar amount. Then there's something called managed care plans. And this is where your care is bundled, services are bundled, and there's typically a network of providers. And those providers could include hospitals and doctors and labs, imaging centers. And by virtue of being part of that network, those providers have agreed to accept a certain amount of money for those services. Most people in this country have health insurance through a managed care plan. An example of fee-for-service would be Original Medicare. But one of the challenges is that within managed care plans, there are lots of different options. And here are the three most common. The first is Health Maintenance Organization, or an HMO. HMOs have a small network of providers. Sometimes they're even in the same physical building. Generally, HMOs require that you start with a primary care physician. So if you have a rash, you go to the primary care physician. If the primary care physician can't solve that problem, then they would refer you out to a dermatologist, for example. So with HMOs, there's less choice in providers, and there's a few more hoops to jump through to get the care that you need sometimes. In exchange, you're going to pay the least amount with HMOs. Now, on the other end of the spectrum, we have preferred provider organizations, or PPOs. These are going to have the largest network of providers, many times even across different hospital systems. Most PPOs have some out-of-network coverage. So if you go to a provider outside of that network, they'll cover some of it, but it won't be at as high of a rate as if you stayed in network. PPOs do not require that you start with a primary care physician, so you could go straight to that dermatologist if you wanted to. So with PPOs, you have more choice, more flexibility, less hoops to jump through. In exchange, you're going to pay more. And then in the middle, there's a hybrid option, and this is referred to as an exclusive provider organization, or an EPO. So these EPOs are going to have a larger network of providers when we compare it with an HMO, but smaller than a PPO. And most EPOs have no out-of-network coverage. So yeah, you have more choice, but you have to stay in that network. Most EPOs don't require that you start with a primary care physician either. So with EPOs, you're going to pay more than you would with an HMO, but less than with a PPO. Now, this is often where people will say to me, well, which is better? What do I choose? And the answer is it depends. So it's going to depend first on what's available to you where you live. So there are some places where the HMOs are wonderful and you wouldn't need to go outside of that network. There are some places where the exact opposite is the truth. If someone is relatively healthy, then rarely goes to the doctor and doesn't have any specialists, maybe an HMO makes perfect sense for them. On the flip side, maybe we're talking about someone with a very complex medical situation, and maybe they have specialists that they see at different hospital systems. Well, in that case, we would want to maybe suggest a PPO instead of the HMO so that they could access those providers. This is one of the first decisions that you often have to make when you're choosing your health insurance. Do you want an HMO or a PPO, one of these hybrids like an EPO? What is your situation like, and what do you need? And is it worth potentially paying the higher costs for the PPO based on your situation? So really, the moral of the story is it depends when we think about which is better. I spend a lot of my time talking to people in the cancer community who often do have complex medical situations and want to protect themselves to the highest level possible. So in that case, many people are going to want to go with a PPO as opposed to an HMO, but not always. Now, those terms that I just talked about with respect to the costs and the different type of managed care plans exist regardless of where you get your health insurance. Three main places that we get health insurance in this country. The largest number, about 50% of Americans get their insurance through an employer. Then the next largest group get their insurance through the government, primarily through Medicare and Medicaid. And then there are people that go directly to a health insurance company to purchase their health insurance. But again, those terms and those choices exist in all three of these options for health insurance. When you can enroll in health insurance is going to depend on what type of health insurance you have. So if you get your insurance through an employer, they will often have an annual open enrollment period, usually in the fall, but not always. And that's your opportunity to decide, are you going to stay with the same plan? Or if there are other options available to you, are you going to switch those around? For individuals receiving Medicaid or eligible for Medicaid, which is the federal health insurance program for individuals with lower incomes, as soon as someone becomes eligible, they can apply. Applications are accepted year-round. For individuals who are over the age of 65 or have been receiving Social Security Disability Insurance, SSDI, for 2 or more years, and are therefore eligible for Medicare, there is an annual open enrollment period between October 15th and December 7th. For people who are purchasing their own health insurance through a state health insurance marketplace, sometimes referred to as Obamacare, there is also an annual open enrollment period. We don't have the exact numbers for 2020, or exact dates rather, for 2023 yet, but open enrollment will start November 1st. We just don't know how long it's going to go this year. Last year, it went through January 15th. Now, Medicare and marketplace plans are calendar year plans. So even if someone picks a plan on day 1 of open enrollment, that plan doesn't start until January 1st. So it is very important for people to make sure that they maintain their coverage that they have right now through the end of the year before their new coverage kicks in on January 1st. Now, the good news is all different types of health insurance recognize that things don't just change during those annual open enrollment periods. So each type of insurance has what's referred to as a special enrollment period. So if you experience a loss of coverage or a life-changing event, like you've moved to a new state maybe, or maybe you you can no longer work and you're leaving your job, that's going to trigger a special enrollment period and actually give you some options as to where to get health insurance moving forward. And for anyone who's concerned about this, we have 2 resources on options when losing employer-sponsored health insurance. We have an animated video that is available at triagecancer.org. And then we also have a printed quick guide that you can read online, download, and print off on options when losing employer-sponsored health insurance. And it walks through the different options that you might have and how you can make choices between those options. When we are thinking about options and we have more than one option, how do we actually make those choices? I'm going to give you an example using plans that are sold in the state health insurance marketplaces. But the same analysis or exercise can be done whether you're trying to decide between 2 plans sold in the marketplace, whether you're trying to decide, hey, my employer offers me plan A and plan B, which would be better for me. You can use the same analysis. Maybe you're trying to decide, well, do I take my employer plan or do I maybe go buy a plan in the marketplace? Or if you are trying to decide between 2 Medicare Advantage plans. the same analysis is going to work for you. So here we are with 3 different plan options, and I'm trying to figure out, hey, I have a serious medical condition or the potential to be diagnosed with a serious medical condition. So I want to make sure that I'm protected, worst case scenario. So I want to figure out which plan is going to cost me the least by the end of the year, assuming that I'm going to hit my out-of-pocket maximum, which is a pretty safe assumption when we're talking about cancer care or other serious medical illnesses. So here we have 3 options. We have a bronze plan that is $200 a month with a $6,000 annual deductible and an $8,000 out-of-pocket maximum. We have a silver plan with a $275 a month premium, a $2,500 deductible, and a $6,000 out-of-pocket maximum. And then finally, we have a platinum plan with a $400 a month premium, a $0 deductible, and a $2,000 out-of-pocket maximum. So I'm looking at these plans and looking at these numbers and trying to figure out which is going to cost me the least by the end of the year. So how do I do that? Well, you have to do the math. And the way that you do the math is you take that monthly premium and multiply it by 12, because that's how much you're going to pay in premiums for the year. And then you're going to add the out-of-pocket maximum. And when you do that for all 3 plans, monthly premium times 12 plus out-of-pocket maximum, you can see that that platinum plan ends up being over $2,000 less expensive come the end of the year. And the reason that we do this exercise is because many times people will just look at that monthly premium and make a decision just based on that number. And they'll think to themselves, well, I can't afford $400 a month, or that's going to be way too expensive. Why not just get the $200 a month plan? But without doing this full math, you're going to end up spending more at the end of the year, potentially. But that's not the only piece of this puzzle. We certainly want to look at that overall cost, but we also need to consider, well, what are the deductibles? What is included in the out-of-pocket maximum? Sometimes you may end up with a plan that is slightly more expensive, but has a significantly lower deductible. So for many of us, it's easier to pay a little bit more each month in premiums than it would be to write a sizable $6,000 check, for example, for that annual deductible, because you have to pay that deductible before the health insurance kicks in. So there's the total annual cost, but then we also need to look at, well, what is manageable or feasible in our situation? We can't stop there, because we also need to double check before we settle on a plan that that plan covers all of the providers and the facilities that we go to. Because typically those out-of-pocket maximums are only going to take payments or consider payments to in-network providers. So if you pick a cheap plan, you think, great, this is fantastic, I picked a really affordable plan, but it doesn't cover any of your providers, you're not actually picking the most affordable plan. And the same is true for any prescription drugs that you might take. You want to make sure that anything that you are taking currently or potentially may take in the year ahead, to the best that you can, is included in that plan's formulary. So we know that this is a lot and it can be confusing. And how do you check if the providers are included? If you are purchasing through the marketplaces or healthcare.gov, there is a way to put that information into the online system and see if your providers are included. But I wouldn't necessarily rely on that information, because we do know that it's not updated as frequently as maybe we would like it to be. So it is always useful to go and check with the provider themselves to make sure that they are accepting that plan for the year coming. Now, because we know that this is a lot to deal with, we have 2 resources. We have an animated video that walks through that exercise. So if you'd like to watch it again, you have that opportunity. And then we also have our health insurance worksheet. And I want to just walk you through Eloise's story to show you how our worksheet may be useful for you. So Eloise is trying to figure out her health insurance options. She's offered insurance through her employer, but is worried it maybe is too expensive. She's also found a plan on the marketplace that does cover her prescription drugs and her providers, but she's trying to figure out, well, which is going to cost her the least, assuming that she's going to hit her out-of-pocket maximum. So this is where our worksheet can be very helpful. And this worksheet is downloadable for free on our website, triagecancer.org. And I've given you the link here. So I've just blown up the worksheet so we can see it. At the top portion, you can add some information about the plan. So is it from the marketplace? Is it an HMO or a PPO? What are the names? And then there's just some reminders to check in on, have you checked for your providers and your prescription drug plans? Then in the bottom part of the worksheet, you have an ability to put in some numbers. So monthly premium, you're going to put in the deductible. One has a $344 a month premium, a $0 deductible. It's a 70-30 plan, and there's an $8,200 out-of-pocket maximum. So you're going to just fill that in from the sheet that you're looking at or from online where you're looking at healthcare.gov. Option 2, and this one also has a separate prescription drug deductible. Option 2 has a $357 a month premium, so very close to the other one. It has a $750 deductible, and it's an 80-20 plan, and there's a $7,500 out-of-pocket maximum. Then we take those numbers and put them in the corresponding letter in the math problem. And when we do that, we can see that, as I click through here, you just take those numbers from the top sheet, put them down into the worksheet, and then actually do the math. So 344 times 12 plus the out-of-pocket maximum for medical plus the out-of-pocket maximum for prescription drugs. Total annual cost is going to be $13,828. Option 2, we're going to do the same thing for, but we're going to use a different math problem here because there isn't a separate deductible. It's included in the out-of-pocket maximum. So it's a slightly different math problem. Monthly premium times 12 plus deductible plus out-of-pocket maximum. And here option 2 costs us $12,534. So Eloise now knows if both plans cover her providers equally, option 2 ends up being over $1,000 cheaper come the end of the year. So that's how you would use this worksheet. And certainly you could compare more than 2 plans. You would just print out a second worksheet. So I know that that we've gone over a lot, but the bad news is getting the health insurance policy is really only half the battle. The other piece of this is once you have the policy, we have to make sure that you're making the most of that policy. Using in-network providers whenever possible, paying attention to bills to make sure that everything you're being billed is accurate, leveraging those out-of-pocket maximums. So to the extent possible, can treatment all be in the same calendar year so that you're not starting over at 0? Maybe there's other medical care you may need to get in that year. And then if you receive a denial of a claim, make sure that you are appealing that denial. And we have tons of information at triagecancer.org to help you with that appeals process. We also know that sometimes just having educational resources isn't enough. And so we have our legal and financial navigation program where anybody can reach out to us, fill out a form on our website, and schedule a call with one of our expert staff, and we'll walk you through various options that you might have, the laws that may apply to your situation, and help you figure out the pros and cons if you have multiple options. So you can just go to triagecancer.org/get-help to access the navigation program. And even if you don't need that direct one-on-one help, I certainly hope that you will continue to have a relationship with Triage Cancer. So Join us at our events to learn more about the practical and legal issues that may arise. We release late-breaking news that is pertinent to the healthcare community in our educational blog. We're on social media. So I hope that you found today's session useful, and I really appreciate being here. Thank you so much.